Hi, my name is Brad Siff. I'm the founder and president of BioWave. Welcome to this month's webinar. The topic is BioWave pain treatment applications using the Hand-Wrist BioWrap. And this is in particular for providers like occupational therapists or certified hand therapists who are treating patients who have hand and wrist pain. This is an image of the Hand-Wrist BioWrap, and here we are showing an image of the inside of the Hand-Wrist BioWrap as compared to conventional electrodes. So there are numerous advantages to using a BioWrap versus conventional electrodes. The first and biggest advantage is that it allows for treatment of over 6 times the volume of tissue using these circumferential silver fabric electrodes as compared to conventional electrodes. The BioWrap also provides compression simultaneously while allowing high-frequency signal delivery into deep tissue. There's no guesswork as to the electrode placement location, and it's reusable. It's easily cleaned, and we provide a 1-year warranty on this medical device. The Hand-Wrist BioWrap is designed to be used in conjunction with a BioWave Home prescription device or the BioWave Pro clinic device that's used in hospitals, clinics, and athletic training rooms. The Hand-Wrist BioWrap comes in 2 different sizes. There's a small medium that's for wrist circumferences between 5 3/4 inches and 7 inches in circumference. And then there's a large/extra large size for larger diameter circumference wrists between 7 inches and 8 inches in circumference. And this wrap is designed to be used either on the right side or the left side. It can be used on both hands. The way it's designed on the inside of the BioWrap, there is a large built-in circumferential silver fabric electrode which encompasses the entire region around the hand. That's the upper electrode in the image that you're seeing. There's also a second circumferential electrode that goes all the way around the entire wrist. And then there's a hole through which your thumb is placed, whether it's your right hand or your left hand. And there are compression straps attached to each of the electrodes, and there are Velcro closures at the end of the compression straps. On the back of the BioWrap, there are 2 snap cables, and the lead wire cable from your BioWave Home or BioWave Pro device plugs into these 2 snap cables. The advantage of having these 2 circumferential electrodes is that they target all the major nerves coming down through the wrist down into the fingertips. This includes the median nerve, which passes through the carpal tunnel and provides sensation to the palm, the thumb, the index finger, the middle finger, and half of the ring finger, as well as motor function to several of the muscles in the hand. The active electrical field also will encompass the radial nerve, which runs along the thumb side of the wrist and provides sensation to the back of the hand from the thumb to the middle finger, but it does not have motor branches in the hand itself. And the active electrical field created also captures the ulnar nerve, which passes through Guillen's canal at the wrist and provides sensation to the little finger and the adjacent half of the ring finger, as well as motor function to most of the small muscles in the hand. So this is a very universal tool for targeting all of the nerves running through the wrist down to the fingertips. What's interesting about the BioWave active electrical field is that it really doesn't matter what's causing the pain, as long as that active field is created in enough depth to capture the nerves in the location where the pain signals are being conducted from that location up to the brain. So it really allows this to be a tool that can be used to treat almost any type of nociceptive or neuropathic pain condition. So, for example, it can be used to treat nerve pain like carpal tunnel syndrome, ulnar nerve compression, pain from radial nerve injury or peripheral nerve injury, pain from Wartenberg syndrome, and nerve pain from other types of systemic conditions. It's also very effective at treating tendon pain, for example, like tenosynovitis or flexor or extensor tendinitis. It can be very helpful to treat joint pain. So, for example, osteoarthritis of the hand or the wrist, pain from rheumatoid arthritis, pain from bursitis, and phalangeal or interphalangeal joint pain. Finally, this tool, the Hand-Wrist BioWrap, can also be used to treat pain from trauma and overuse. So, for example, pain from sprains and strains, pain from dislocations, pain from repetitive strain injury, and pain from cartilage and soft tissue injuries. So there's a lot of potential applications for use with the Hand-Wrist BioWrap. Now let's talk about directions for use. In order to take advantage of these very large area electrodes around the hand and around the wrist, and to be able to drive the signals from your BioWave device through these large area electrodes, we need to apply a conductive cream, and specifically TheraCream. The cream has to be applied to the skin and rubbed thoroughly into the skin in the regions where the silver fabric electrodes touch the skin, all around the hand and all around the wrist. It's important that the TheraCream is rubbed into the skin. Do not rub the TheraCream onto the silver fabric electrode. It is fine to spread the TheraCream on the skin beyond the location that the silver fabric touches the skin. That's okay. You can be a little liberal in the region that you're spreading it. As long as everywhere the silver fabric touches the skin, you've got TheraCream rubbed into the skin. So start with the hand, squeeze a generous pea-sized amount of the TheraCream onto your finger, rub it completely around the front of the hand, the back of the hand, the sides of the hand, and make sure there's no clumps of white cream still visible. You really want to rub it in well. Similarly, squeeze another generous pea-sized amount onto your finger and then apply it to your wrist. Rub it in all around the front of the wrist, the back of the wrist, the sides of the wrist, so you really have it completely covered and thoroughly rubbed into the skin. So that's how we start. Now you're going to hold up the BioWrap so that there's an icon that directionally shows which is the top and which is the bottom, and you're going to insert your thumb through the hole in the BioWrap. So this whole directions for use, we're going to use the right hand as an example, but just to start, I'm going to explain how you would do the right hand versus the left hand. So if you're using your right hand, as in the illustration, you insert your thumb through the hole and your palm of your hand will be against the silver fabric electrodes. If it's your left hand, you're going to insert your left thumb through the hole and the silver fabric's going to wrap around the back of your hand when you're going to start attaching this to your hand. So we're going to continue with the right hand. So the next step is we want to secure the top electrode first. So we're going to wrap the top of the strap around the back of the hand and the back between the thumb and the index finger, as in the illustration in 2B. Do not wrap that strap over your thumb. It's got to be between the thumb and the index finger, and you want to pull it tight to create strong but comfortable compression around the hand. You're going to continue to pull that Velcro strap around the hand. Make sure there are no gaps between the silver fabric and your hand, particularly between your index finger or between the pinky. Make sure there's no gaps there so that it's tight, snug, not too tight, and comfortable. We're going to go on to 2E, the illustration. Now we're going to start with the bottom strap. We're going to pull it across the front of your wrist and then pull it around the back of your wrist. And you want to thread the end of the strap through the D-ring and pull it tight. And again, try to eliminate any gaps on either side of your wrist. Again, try to ensure there's no gaps on either. Typically, gaps would appear on either side of the wrist versus the front or the back. So we have a nice snug fit all the way around the wrist. That's how we apply the BioWrap to the wrist. Let's cover some possible troubleshooting that potentially could occur. So let's say you have a connection error, and this would show up on your, in this case, on your BioWave home device as two pads with an arrow to the body. Two pads with an arrow to the body. You would see the same error indication on your Pro unit for this particular error condition. And this might occur if your skin impedance is too high, or maybe you forgot to apply the TheraCream, so the device, the BioWave device, is not seeing the silver fabric basically attached to your skin. It's not seeing signals conducting through. So remove the BioWrap, clean your skin with soap and water so that it's really clean. If you have hair anywhere on the hand or the wrist, it would be better to shave excessive hair in those locations where the silver fabric electrodes touch the skin. Then take a generous pea-sized amount of the conductive cream, as we described before, apply it directly to all the areas around the circumference of the hand, all the areas around the circumference of the wrist, and then reapply the BioWrap, connect it back to your device, and when you turn it on, this error condition should be eliminated. If you happen to have very sensitive skin, so the impedance is low to start with, and perhaps you put too much TheraCream on your skin, then it could be a low impedance condition. You would see the same error condition. The device is not going to see the BioWrap attached. You'd have to remove the BioWrap, take a towel, remove any excess cream if it wasn't rubbed in well enough. With a towel, remove it from your skin. If there's any cream that's still on the silver fabric that came off on the silver fabric from your skin, remove that with the towel, reattach the BioWrap, and then connect to the device and restart the treatment. And that should eliminate this error condition as well. It's not common, but these are things that can happen. Another troubleshooting issue might be that you feel the treatment sensation to be stronger over the hand versus the wrist, or it's stronger over the wrist versus the hand. So, and this is an example, by the way, of what the TheraCream looks like, the tube that it comes in, and all BioWraps are supplied with this TheraCream. So the way to change this, like say the sensation on your hand is not as strong as on your wrist, and you want a stronger sensation on your hand, then first thing you could try is tightening the compression around the hand. The tighter the compression, the stronger the treatment sensation. If you try that and then increase the sensation, and the sensation still doesn't feel as strong as it feels on your wrist, you can stop or pause the treatment, remove the BioWrap, add more conductive cream to the hand, then put it back on, put tighter compression around the hand, and the combination of both tighter compression and more conductive cream will provide a stronger sensation as compared to what you were feeling on your wrist. And the opposite would apply if you wanted to feel a stronger sensation on your wrist. So the bottom line here is tighter compression and or more conductive cream will provide you with a stronger treatment sensation if that's what you desire. Looser compression and or less conductive cream will provide less of a treatment sensation. So that's the way that you can control how strong it feels in one location relative to the other location, the hand versus the wrist. So that's another type of troubleshooting issue that you can adjust. Let's talk about the treatment protocol. It's a 30-minute duration treatment. Your BioWave devices have a countdown timer that's preset to 30 minutes. So when it gets to 0 minutes, 0 seconds, the treatment automatically stops. We recommend 2 to 3 treatments per day, typically separated by about 30 minutes in between treatments. We find that gives the best cumulative benefit by allowing the body to come back to a normal state before you hit it again with a second treatment. Having said that, if someone's schedule doesn't permit that, but they really want to just get in 2 30-minute treatments or even 3 30-minute treatments all in a row, it's totally fine to do that. You can treat as needed. So if someone wants to do 60 straight minutes of treatment, that's absolutely fine. There's no limit to the number of treatments per day. And as I said, it's really treat on an as-needed basis. But for most patients, 2 to 3 treatments per day tend to be what's typical. And as I mentioned earlier, doctors and patients do report that there's a cumulative benefit with multiple treatments. Contraindications. Do not use this device if the patient has an implanted cardiac pacemaker. And the silver fabric electrodes have to be placed over intact skin. So you cannot use the silver fabric electrode. You can't use this Hand-Wrist BioWrap if there are open wounds, broken skin, rashy skin, or sensitive skin areas like sunburned skin on the hand or the wrist, in the locations that the silver fabric touches. If the patient is wearing a ring or a watch or any metal jewelry, it has to be removed prior to placing the BioWrap in place. Note, BioWraps may be placed over or in the proximity of implanted orthopedic hardware, including total joint replacements, anchors, plates, rods, screws, pins, and clips. So if you have any of those items implanted in the hand or wrist and they're not, and the skin is intact, you can still do a treatment with a BioWrap and use the BioWave device. Cleaning is very important. We strongly recommend that you clean the silver fabric before the first use and after every approximately 2 uses. If the entire BioWrap is going to get washed and it has to be hand washed, you need to remove the snap cables from the BioWrap before you submerge this, say, in a bowl with soapy water. So it's very important. The only way to clean this is to hand wash the silver fabric. You can hand wash the neoprene portion of the BioWrap as well. But the key part is hand washing the silver fabric with mild soap and water. You can rinse the silver fabric with water and pat it dry with a towel and then let it air dry completely. And then once it's air dry, reattach the snaps, and then it's ready to use. Like I said, clean your BioWrap after every 2 treatments. By cleaning the silver fabric, you're ensuring the best electrical conduction of the therapeutic BioWave signals through the silver fabric into your skin, into deep tissue. Very important, never clean the silver fabric using alcohol or any other chemical or any type of wipe, whether it's an alcohol wipe or chemical wipe, that will destroy the ability of the silver fabric to conduct the signals into the body. Do not put this in a washing machine and do not place it in a dryer. This is a medical device. It has to be cared for very gently, and that's why it has to be hand washed and air dried. So thank you very much for attending this webinar. Please submit your questions under the Q&A tab at the bottom middle of your window. And if you have any questions, you can always contact us. If you forget and then think of something afterwards, you could call us at 1-877-BioWave. That's 1-877-246-9283. Or you can email us at info@biowave.com. Again, thank you very much for your time today, and I look forward to answering any questions you may have about the Hand-Wrist BioWrap or its applications. So thank you for listening to the webinar. We have a Q&A box at the bottom of the screen where you can submit your questions. We've got a few questions there right now. So I'm going to start in with the first question. The question is, do people experience difficulty with fine motor tasks after using the hand and wrist wrap for any period of time? And the answer is no. We've never had any reports of that. When you do it, during the treatment, muscles can be held in tension. You feel tingling sensation through the region down to your fingertips. But when the treatment's over, there's residual hyposthesia. Hyposthesia kicks in about 5 minutes into the treatment, and it can last as long as 30 minutes post-treatment. So there's a little bit of light numbness, but it's not enough that it typically would prevent someone from being able to do any kind of fine motor tasks. So that's what one could expect. Now, everybody's body's different, and some people will have a little bit of light numbness for a longer period of time versus a shorter period of time. So, but in general, I would say we have not seen that. Let's see. The next question: can the Hand-Wrist BioWrap be wrapped around the forearm or elbow as an off-label attempt to cover more surface area than the electrodes? The shape is not designed to really wrap around the elbow. Maybe if the arm was kept completely straight. Around the forearm, I actually have a Hand-Wrist BioWrap here. You could put it around the forearm. So if you see here, without putting your thumb through the hole, if you pull this over your forearm and you pull and you tighten both straps so they're tight and you've got some compression and comfortable, conceivably you could treat a large area around the forearm. When you're around the forearm, you won't get all the way around the forearm. You would get 75 to 80% around the forearm, depending upon the circumference of the forearm. But it could work in that region, so that is a possibility. I'd be less inclined to do it over the elbow because you'd have to keep the arm perfectly straight. But it is a way to cover larger areas up in this region as well. But a lot of the same things apply. You have to put the TheraCream around the entire area. You have to make sure this is tight but comfortable, not too tight. Make sure there's no gaps, under the silver fabric. So interesting question, but I could see the possibility of it working in that fashion. Again, it's off-label, but there's no reason it wouldn't work. Next question. Are there any precautions for patients with decreased sensation or neuropathy in the hand? And the answer is yes. And we have a specific protocol for treating patients that have a loss of proprioception, whether it's a result of neuropathy or something else. So in general, if someone has on a BioWrap and they increase the intensity to greater than 50% in less than 1 minute, and we have this in our in, in kind of our warnings label that we provide, instructions that we provide with the BioWrap. We ask you to please stop the treatment, and we would ask you to take the BioWrap off, uh, clean the skin thoroughly with gentle soap and water, dry the skin with a towel, reapply and rub in slightly more Theracream to the skin than you did the first time, and then reattach the BioWrap and gradually increase the intensity. And that's generally patients don't get up to as high an intensity level when they're using a BioWrap with a proper amount of Theracream on the skin as compared to conventional electrodes. So that's why we mentioned that. Now, if a patient wants to exceed 50% intensity, it's okay, but they should proceed very slowly and gradually. We're not even talking about neuropathy patients there. If you do have a neuropathy patient with a lack of or no proprioception, and so there's literally no skin sensation, then the way to increase the intensity is you start very slowly and increase to 30% over the first 3 minutes. Okay. And then we want the patient to wait for 10 minutes. Okay. And then, so at 13 minutes into the treatment, then they can start to increase the intensity by 2 percentage points per minute. And we would tell the patient not to exceed 50%. And that would be the protocol for how a patient with a loss of proprioception or no proprioception should increase the intensity of a BioWrap. That way, we keep them in a very safe range because in general, our devices are the intensity is increased based on sensation, not on the intensity number, because there's a wide variation in nerve supply and how sensitive one is to the signal and impedance of the skin. There's a lot of variables. So this just keeps it at the low end and safe, but there's certainly enough signal being delivered through the electrodes, through the BioWraps to provide an efficacious treatment. So if you have any further questions on that, please don't hesitate to reach out to us, and I'd be happy to talk more about that. Next question. Are there any active range of motion exercises you would recommend doing with the Hand-Wrist BioWrap on, such as forearm rotation or digit front ROM range of motion? So I'm not going to suggest necessarily what type of physical therapy exercises can be performed, but let me provide an example. When you have the device on and you move, whether it's rotation or flexion or extension, that changes the impedance in the tissue of the body. And when you change the impedance of the tissue, the sensation felt can go up if the impedance drops, or if the impedance increases, the sensation you feel can go down. So you will notice a change in sensation with motion, and you'll also notice a little bit of a change in the location of the sensation based on the motion as well. And it's actually a way of directing the active electrical field to the region that hurts the most in the wrist and the hand. So in the example of forearm rotation, you could do forearm rotation like this. I would just always tell the patient to do it slowly if that is a range of motion exercise that would be beneficial for your particular patient. If you want your patient to do digit range of motion, again, you've got the wrap around here. So if they can move their digits, while the wrap's on, it'll cause a change in sensation that they feel from the hand into the end of the fingertips. But if that would be beneficial for your particular patient, it's okay to do that while this is on. If the sensation felt while doing the range of motion with the digits, for example, is too strong, then have the patient hit the minus button, maybe 3 times to take the edge off the sensation that they feel, and then you could begin that range of motion of the digits or the forearm rotation. So generally when you and this is part of our general physical therapy protocol that we teach with the conventional electrodes. We always take the intensity down by 3, 4, 5%, at least with regular electrodes. With this, you might not need to take it down as much, but you take it down to take the edge off the sensation. Then when you move, if you're causing an increase in sensation, it won't be a surprise to the patient. So that's how you would handle range of motion exercises while that BioWrap is on. And then finally, let's see, yeah, the last question here. This seems like a great option for patients with CRPS and difficulties with edema management after distal radius fractures, ORIF, especially if they can do digit ROM with it on. And I would agree. It's in addition to managing the pain and reducing the guarding effect associated with pain, so you are able to do some range of motion exercises. There is increased blood flow in the volume of tissue where the active field is. So, that might help with edema management. You may not see any significant benefit from a single treatment, but if the patients are doing this a couple times a day over the course of a couple weeks, if increased blood flow can facilitate healing in a particular condition that a patient has, then that's why patients may find that they get a cumulative benefit with BioWave by using this over time. Yeah, I'd have to agree that it would be a great option for patients with CRPS. All right, well, if you want to reach out separately, please email us at info@biowave.com, or if you have my personal email, I'm happy to answer any questions. Thank you very much for attending, and look out for our next webinar about a month from now. I hope you found this helpful and educational and interesting. So thank you very much for your time.